Laser vaginal rejuvenation is a modern, painless, safe, and minimally invasive method for treating and preventing many female intimate issues. The procedure is performed using a fractional CO2 laser, which works by creating controlled localized damage to the vaginal mucosa through its thermal and ablative, meaning vaporizing effects on the tissue. This in turn stimulates the synthesis of new collagen and components of the mucosal extracellular matrix, specifically proteoglycans. Thanks to this physical effect on the vaginal mucosa, rapid and safe restoration occurs. So, what are the indications for performing the laser vaginal rejuvenation procedure? They are as follows. Vaginal relaxation syndrome, stress urinary incontinence, postpartum recovery, first-degree genital prolapse, first-degree genital descent, dyspareunia or painful intercourse, scarring of the mucous membrane due to tears during childbirth, as well as episiotomy performed during childbirth, vaginal dryness or cirrhosis, and non-specific and recurrent non-specific infections of the genitourinary tract, as well as urogenital syndrome. Vaginal relaxation syndrome, as well as the initial manifestations of genital prolapse as a result of childbirth, heavy lifting, or intense physical exertion, lead to decreased sensitivity during sexual intercourse for both the woman and her partner, which in itself results in the development of both physical and psychological disorders in the woman. Vaginal relaxation syndrome can also lead to the occurrence of so-called vaginal flatulence, that is, the presence of air in the vagina during sexual intercourse or during physical activity. In these situations, laser vaginal rejuvenation, by acting on the entire vaginal area, restores tissue elasticity and eliminates the aforementioned problems. Urogenital syndrome, which is more characteristic of menopause, includes a set of symptoms caused by a deficiency of the female sex hormones estrogens, namely vaginal dryness, urinary incontinence, dyspareunia, that is, painful sexual intercourse, as well as recurrent infections of the genitourinary tract. Laser vaginal rejuvenation, in this situation, as a modern method of addressing urogenital syndrome, may be suitable for women who cannot or do not wish to undergo treatment with hormonal medications. Additionally, this procedure can be used as a combined method for treating urogenital syndrome together with hormone replacement therapy. The contraindications for laser vaginal rejuvenation are as follows: pregnancy, purulent inflammatory processes in the genitourinary organs, oncological processes of the genitourinary tract and pelvic organs, viral processes of the genital organs during exacerbation, second or third degree genital prolapse, and obstructive type urination. Before undergoing the laser vaginal rejuvenation procedure, a gynecological examination is required, including mandatory cytological analysis of cervical smears, testing for sexually transmitted infections, and an ultrasound of the pelvic organs. The clinical effect of laser vaginal rejuvenation becomes fully apparent by the end of the first month after the procedure. During this period, the vagina is tightened, its mucous membrane becomes thicker and more hydrated, symptoms of urinary incontinence either disappear or are reduced, and sexual function improves. Depending on the indications and the severity of certain symptoms, the procedure is performed at the interval of 1 to 1.5 months, up to 3 times a year. So what is recommended after undergoing the laser vaginal rejuvenation procedure? It is recommended to abstain from sexual activity for 7 days, avoid visiting baths or saunas for up to 1 month, refrain from using vaginal tampons for 7 days, and also avoid intense physical activity during this same period.